Keeping Americans healthy and getting the coronavirus pandemic under control is, of course, the top priority for Congress and the president right now. Joining us is Illinois Republican Congressman Adam Kinzinger. He represents the 16th District. Thank you so much for joining us on the phone again today to keep us posted on all new developments that are taking place in Washington.
Yeah, you bet. Good to be here.
Yeah. So yesterday, you said that you had a follow-up conference call with our local health care providers. What did you learn about the coronavirus when it comes to the state of Illinois?
Well, the local hospitals are as prepared as they can be. They're starting to see this surge that they fear that we know is coming. They're doing everything they can to prepare. The big issue right now is, again, most people just have symptoms similar to a cold, but there's a number of people that then will need hospital care. And the key is making sure that they have space in the hospital for those people, because the difference in survivability for somebody that doesn't get treatment that needs it and somebody that does is pretty big. So what we're trying to do is make sure that space is there. The hospitals are doing the best they can to react. But again, we have not seen the main surge of this yet. And the big key is the shortage of ventilators, which, if you have complications with this disease, would require.
Yeah, absolutely. I know that a couple of hospitals right here in Chicago have already sent up tents outside so that they can help some of the patients that are coming to them initially. But as you just said, the question is, are there enough beds and ventilators for anybody that absolutely needs them? Are our hospitals going to be prepared in this case? Or are we looking at shortages here from what you understand?
Well, I think quite potentially shortages if people don't do what the president and the governor are suggesting, which is stay inside, because that's the key, is to slow down the spread. And, hopefully we can get a vaccine soon. But at this point, it's to keep that spread slowed down so that we can get the people into the hospitals that need it. That said, I'm hearing cases of people, especially millennials and younger, that say, well, I'm not going to get bad symptoms. I'm going to go out in big groups, and that's going to be the issue. Everybody is in this together. And by the way, there are young people that are having major complications as well. It's not only older people. It's just that they are more likely to need hospitalization.
Today is Election Day. A lot of times we talk about, is the weather going to prevent people from getting over to the polls? But now we're talking about the coronavirus. It's like the weather isn't even a factor here. Does it bother you at all that we didn't move our Election Day here in Illinois?
I'm kind of mixed on it. I mean, on the one hand, democracy has to go on. On the other hand, we are really at the front of what's going to be a big surge. So I would just, since it's going on, I would encourage people to obviously maintain that distance if you're in line, ensure that, everything's clean as you use the voting machine. Still get out and vote, but minimize your exposure out there. So, given that this is really actually the worldwide or the U.S.-wide kind of lockdown on this, has been very recent. I understand that it's going forward, but people just need to be very, very careful.
You're absolutely right, and hopefully everybody is wiping everything down before and after they use those machines. Congressman, thank you so much for joining us this morning here on Good Day Chicago. We always appreciate hearing from you, and so do your constituents.
You bet. Anytime. Take care.